Sir, with the Jackson County Health Department, Matthew Budd. Hey, Matthew.
Morning, Deputy.
Morning. Thanks for having me here.
The vaccine, is it here?
The vaccine is here. And the vaccine, I can say all three that people are pounding on our doors for, which is the influenza or the flu.
Yes.
And I will say that's the vaccine we're giving the most of right now. And then we have the new updated COVID-19 booster.
Nice.
Which is another monovalent strand, but it's thought to be protective of what we're seeing now. And then we also have the RSV vaccine, which is recommended for individuals 60 and older with conversation of their primary care.
Since the last time you were here, Bart has had the old COVID-19 and had to sit out for a while. So, should he get the vaccine?
Should he get the vaccine?
Yeah.
I recommend everyone to get this updated formulation. It'll offer protection. I imagine we'll be having the same conversation next fall too, and I'll be recommending that one, just like the flu.
I asked Dr. Donna, I saw her a couple nights ago, and she said I should wait 3 months after having COVID
After you had the
because
COVID.
I have 3 months of immunity.
Oh,
So
Good.
then get the thing. And like Travis Kelce, you can get two, can you get three?
You can get all three.
vaccines?
You can. I don't know if I would recommend it. If you are good and you know you'll go back and get them, give it a week or two in between.
Yeah.
But if you are one of the type of persons you just want to get it done and over with, go ahead. Because it's more important to get those vaccines than not to. But we do know you get some arm soreness from any of those vaccines. And sometimes you can get some flu-like symptoms as your immune system recognizes that vaccine and starts kicking in. And that's what makes us feel sick most of the time. It's our own immune system, of course. So.
Is there enough vaccine at the health department for everyone to get one?
No, but our pharmacy partners, our healthcare partners are great resources. Definitely recommend talking to your primary care providers this fall about which vaccines you need. Our pharmacy partners have really stepped up in the pandemic, and our pharmacies, they were really good with the flu vaccine, but they carry a lot more vaccines these last 3 years now too. And if you look in our community, the pharmacies actually provide the most vaccines for like flu and COVID.
No, they're the place where the drugs are, so it makes sense.
That does make sense.
And I've noticed the messaging has been the vaccines, they're going to, it's not complete immunity. You could still get any of these things, but it'll be far less severe if you have the vaccine.
Yeah, I think that that's true. And I've come to really hate the word immunity when we think about vaccine, right? And I think that we've thought that this is this shield that's magical and will keep us from disease and illness. But the way I like to think about it is we think of things like hepatitis B or hepatitis A. Let's say there's a food outbreak. It's not going to make me feel like if I get that vaccine, I can go and eat any food if I know that some worker might have hepatitis A. There's still some risk there with any vaccine because there's some immune escape. Where like we might not have full protection, but we're much more protected.
It's Baby Safe Sleep Awareness Month.
Yes, absolutely. We do a lot of programming at the health department, of course, through maternal, infant, child programming, WIC, maternal infant health, early on programs, and we also do a lot of safe sleep education. And of course, I think one of the important things that we go through, and I had a staff member remind me today, we have the ABCs of safe sleep, which is sleep always on your back. I have that wrong because I have B. Alone is the A, on your back, and then in a crib. Bassinet, pack and play, but a harder, softer surface, free of blankets.
Right. No blankets, no toys.
Well,
No.
Quinn, your nephew, my grandson, sleeps with a metal school bus. Is that a good idea?
Probably not.
How old's Quinn?
We're not sure. Actually, I think he's almost 2.
Yeah. That safe sleep is really important. That first year of life is really what we look for, and that's where we have the highest risk for sudden infant death syndrome and safe sleep complications. So it's that first year of life that's really most crucial, most important.
And the information changes quite a bit. So say you had a child 12 years ago and now you're getting ready to have another child. The information has probably been updated and changed.
Yeah, absolutely. I think we always try to follow the best available evidence, and I think we know that information changes rapidly. Hopefully we all know this now, and I think it's fantastic when we get new information and we realize, hey, you know what we did before wasn't quite as good as what we can do now.
Yeah, and some of those unsafe sleeping things have been recalled. They've been taken off the market, but they're still available on a secondary market.
Oh, absolutely.
Yeah.
Whenever you get a secondhand, like car seat, is
Right.
one that you see a lot. You really have to do some good inspection. Make sure that the expiration hasn't been there. Make sure the car seat wasn't available in a crash, for instance. And then, yes, of course, a lot of those sleeping cribs and things like
And
that.
you guys post a lot of the recall notices on the social media pages as well.
We do. They're really important.
You talked about trunk or treats. The health department will be participating in the Halloween Town Trunk or Treat, which is at the American One. I don't know if you knew that.
Not yet.
But yeah, that you will be participating in it. What would the health department pass out for Halloween?
We've had some conversations. I'm pretty adamant that we don't pass out candy.
Okay.
And I'll tell you why. We have a dental program, Smiles on Wheels, right, in
Yeah.
our building. I feel like we can't do that disservice. We don't want to send more people to Smiles on Wheels. But we do have things like slap bands that
Oh, those
are
are good.
reflective.
Yes.
Perfect for trick-or-treating if you
Yeah.
go out later. Hand sanitizer, tissues. Every kid needs hand sanitizer and tissues for school.
Well, the parents will go through the bag and grab that stuff out and use it.
One thing that I've been following in Europe, bed bugs are sweeping the continent. Are they going to come here?
They're here.
They're here. Haven't you ever that Carlton Lodge Inn? Remember
Where?
the Carlton Lodge?
Oh, the Carlton Lodge?
I mean, places
have
like that have bed bugs.
Well, you know, every once in a while, and the big things with bed bugs is you want to prevent them. Or if you see them, you want to move very quickly because bed bugs, once they're established, they're going to be there and they're much harder to get rid
I've
of.
heard of people going to hotels and saying that they had bed bugs. I've never had that experience, at least that I'm aware of.
They would get in your luggage. Here's a
Luggage?
hint. Put your suitcase in the bathtub when you check into the hotel
Really?
because the bed bugs cannot climb up a slick surface.
I
What
always
are the bed bugs?
pull down the sheet. Well, they're insects. I mean, they're bugs. And,
yeah, but
and
what kind?
Bed.
yeah, bad.
Bad.
They're a lot like lice, but they like they get a blood meal.
Movie
And they-
theaters. Movie
Really?
theaters.
Yeah, but
Yes.
and it doesn't matter which hotel. It could be a 5-star hotel or a 1-star hotel.
Is there
So
a
I'll just put
vaccine?
that out there too. There is not. But you know, I'll tell you, they're a nuisance. So when we do get calls for bed bugs at the health department, sorry to say, there's not a communicable disease risk. We'll give some advice. We have some resources, but there's not much we can do.
Does the health department give stars to the Jackson hotels?
That'd be a great idea.
We don't. No, we don't want to be involved
Yeah,
in that.
Jackson hotels are great. Jackson hotels are great, but yeah,
Yeah.
never had the bed bug issue that I'm aware of.
You don't want them.
Yeah. So it sounds like you've had.
No, I've never had them.
Okay. Well.
I don't think you have them.
Okay. Well, again, thanks so much for being with us. And any information, just a phone call away, and you can certainly call the health department with any questions. Matthew Budd, thank you very much for joining us today.
It's always a pleasure.
More of the show right after this quick break.